Welcome back. I'm Dr. Farber.
I'm Dr. Shah.
Today we're going to talk about liposuction, which is a very popular procedure. In fact, it's probably the second most popular procedure in the entire country. So we do this quite frequently. And what is it? So liposuction involves infiltration. So we inject this saline solution right into the fat under the skin. And after that, we use a power-assisted device, so basically a suction cannula that sucks out the fat, and at the same time it vibrates to help break up the fat that lets us remove it easier. So that's really all it is. It's exactly what it sounds like, liposuction, just sucking out the fat.
You may be wondering if you're a good candidate. So as with every other surgery, you should be healthy. And for this one, you should be at your ideal weight. Liposuction is most effective when it's used as a body contouring procedure. It is not a weight loss procedure. And unfortunately, that's a misconception that people have out there. So when you're trying to decide, should you get an abdominoplasty, should you get just liposuction, one of the things about liposuction is that it does have an easier recovery than a full-out abdominoplasty, but it is not going to significantly change what is going on in the inside. With abdominoplasty, you can see our video on tummy tucks, but we're doing plication of the muscle, we're doing removal of extra skin, we're doing a lot of things, and liposuction is done in combination with it, but it's not used to change a lot of things on the inside because that's not what that procedure is for. So when people are asking, do I want an abdominoplasty or do I want liposuction? What I usually tell them is, if you are happy with you, but a little bit smaller version of you and more contoured in certain areas, then yes, liposuction could do it. But if you want a big change, then an abdominoplasty is usually going to do it for you.
Yeah. So what layers of fat do we actually suck out when we're doing liposuction? So there's different layers of fat in your body. So there's fat that's directly under the skin. There's a couple layers of fat that's directly under your skin. And then you have your, like for your abdomen, for example, so you have your skin, and you have layers of fat, and then you have your abdominal wall with your abdominal muscles. And under that are your intestines, and you have fat around your intestines. If you're overweight, you have increased fat around your intestines. So if we do liposuction, we can only address the fat that's directly under the skin. We cannot address deep fat. Where it is in the body, it doesn't matter. It's too dangerous to do, and no one does that. So the only way to address that is with weight loss. So that's why we say we want you to be at your ideal weight in order to have a liposuction procedure done. That reduces the circumference of your abdomen or other areas, so we can get great contouring results from the actual liposuction procedure, which is addressing the subcutaneous fat, which is directly underneath your skin. So that's what we address during a liposuction, and we want to make sure that you get your best results. So be at your ideal weight. We want to reiterate that liposuction is not a weight loss procedure. It is a contouring procedure.
Liposuction can be done in many parts of the body. So it can be done here, here, but basically anywhere, almost anywhere you can do liposuction. But things that are important to keep in mind is, do you have loose skin? Because with liposuction, you're removing the extra fat. And if too much fat is removed, then you may have extra skin. Sometimes liposuction is done as a staging procedure, meaning you do it first, there's a lot of hanging skin afterwards, and then you take it off. But that's for another video. So for under the chin, for example, if you have really like good quality skin, it's very elastic, you don't have a significant amount of fat underneath there, you just want it to be more chiseled, more contoured, then you're a good candidate for liposuction in this area right here. On the arms, the skin right here on the arms and also on the inside of the thighs, it doesn't tend to be as elastic as some of the other parts of the body. So for this area, it will tighten up, but if you have a lot of hanging skin under the arms, then you're just gonna get more loose hanging skin, because then the fat's going to be removed. On the thighs, the inside of the thigh, these are all areas, or on the flanks, these are all areas we can contour it, we can remove the fat, but there's a balance between removing too much fat and removing enough that you still have a beautiful shape and contour versus skin that hangs down. Now, if you have the skin that hangs down, then liposuction can be included with other procedures that remove extra skin. So again, take a look at our abdominoplasty and mini tummy tuck videos, and sometimes people will want liposuction on the lower abdomen or throughout the abdomen, but they have extra skin on the bottom, and we can remove that skin at the same time. Liposuction can also be done with the arms, and we can do a resection, same thing with the thigh.
I just want to reiterate that consulting with either Dr. Shah or myself, we'll let you know what's the best procedure for you. If you come in wanting just liposuction, we feel like you have extra skin, we'll let you know, and we want to make sure that you have the best possible results. So if we suggest removing skin in addition to liposuction, that may give you the best possible results. So come in with an open mind, and we're happy to discuss all the options with you. A couple things that we want to talk about too is about recovery. Actually, before I even go into recovery, is that a common question that patients have for me, and I'm sure that Dr. Shah has the same kind of questions from her patients, is when patient gets liposuction, they say, well, if I eat unhealthy and maintain this unhealthy lifestyle, will I gain the fat back? Well, the answer is yes and no. So, if the idea is you want to maintain a healthy lifestyle after your procedure. So liposuction is not a cheat. It's not a shortcut to a slimmer body, because if you maintain the same unhealthy lifestyle afterwards, unhealthy eating and lack of exercise, well, you are going to gain weight. You may not gain weight directly in that area that had the liposuction, but you will gain weight in other places. The fat that's removed, it's removed permanently, but there is still fat that remains there. So the fat will behave as it always has. So if you gain weight by maintaining unhealthy habits, then you can gain weight in that area again. So it's important that you have this procedure done, that you want to maintain the best results possible for the remainder of your life. So we want to reiterate that with all our patients, is that when they come for this procedure, they have to make sure that they maintain a healthy lifestyle. Otherwise, the results will not last.
Actually, going along with that, the other question that we get is, if I get liposuction, do I gain weight elsewhere? So the way to think about it is that your fat cells, when you have calories coming in, the calories have to go somewhere. So they're going to go to the fat cells. When you do liposuction, we are removing the fat cells in that area. So now you still have this, if you have the same amount of calories coming in, it still needs somewhere to go. So if you have less fat over here, but you have the same amount of fat over here, they'll both grow, but this one may not look as big as it did before because you have less fat cells. But the other side, the other places may take up the slack for the lack of cells on that side, and you may get bigger in other parts. So it's not that you're just going to get bigger. If you have a calorie intake that's in excess of what you normally do, or fat calories more than what you need per day, you will gain weight in other places.
And we'll talk about nutrition in a whole other video. Stay tuned for that one. I want to make sure that patients understand the recovery. So depending on the areas that we do liposuction, if it's a small area like under the chin, or just maybe a small area of the abdomen, recovery is pretty simple. Patients are actually back to work within a day or two. Granted, you have to wear a compression garment for 6 weeks afterwards. So we want to make sure that the swelling goes down as fast as possible. The skin will contour back down to the underlying tissue after the fat is removed. So that's why it's important to wear the garment for about 6 weeks afterwards. We do encourage you to get lymphatic massage, which we found it really helps our patients in terms of reducing swelling. We have relationships with people in the area to set you up with that afterwards as well. We typically start that about a week after surgery or so. So, we want you to refrain from strenuous exercise for, about 2 to 4 weeks, depending on what procedure you had and how much liposuction you had. But typically the recovery is definitely faster than other procedures that involve big incisions. The liposuctions are tiny little poke holes where we insert the cannula, and you will have one stitch that closes it up, and typically that heals just fine. The important thing to know is swelling. So swelling can last, and everybody's different, of course. Swelling can last 6 months or even up to a year. So usually the majority of swelling is gone within the first 6 months. But for the first 6 months, there could be a significant amount of swelling that it makes it look like nothing has been done. But just be patient, and with time, that swelling will go down, and you'll see a great contour and a great result afterwards. So we just want to make sure that you're patient. Another thing is that if you do increase your activity, whether it's exercise or whatever it may be, or if it's hot outside, you may swell up for that first year. So just don't freak out, be patient. That swelling will go down. It just takes time. This is just part of the process after liposuction. And I mean, that's really it. That's liposuction in a nutshell. We hope you enjoyed the video. Stay tuned for the next one.
See you soon.
See you soon.